Okay, good afternoon, everyone, and welcome to the parallel track in the Jacobs room. We are Erik van Raaij and Vikrant Sihag, and we will share with you the learnings of the business modeling experiences that we had with the 12 pilots. So I'm handing over to Vikrant, who will start with the presentation.
Good afternoon, everyone. As Eric said, we welcome you to this presentation related to the business model innovation role within the BigMedilytics project. My name is Vikrant Sihag, and I'll be starting the presentation. And later on, we'll discuss different elements, what we did within the BigMedilytics project, what was the role that business model innovation played within the BigMedilytics project, and then finally, we would also look at some of the examples. So Eric would present some of the examples and how we used the healthcare canvas that we specifically developed for the BigMedilytics project. And finally, how we used it as a platform to think about the future action plan. Without further ado, I would like to take you to the presentation that we have prepared for this afternoon. So let me share my screen. So the presentation is, I hope you can see the presentation. Let's first start with the idea behind the business model innovation in healthcare. So we have seen traditionally business model innovation has been used in a lot of places. So we also started with the same notion that is associated with the business model innovation. To be very specific, at the beginning of this project, Eric and I, we looked at the traditional business model canvas that is being used in a lot of areas and domains to think about the business model related to various projects or related to various organizations. Specifically, a lot of organizations use the traditional business canvas that you can see on the screen to think about how they are going to deliver value to different customer. So they begin with identifying various customer segments to which they will be adhering to, or to which they will be delivering value, and then they think about the value propositions for these customer segments. After that, they think about various customer relationships and channels through which the value proposition would be developed. And then later on, they think about the key activities, partners, and resources that would be involved in delivering the value proposition. Uh, Based on that, at the bottom you can see that a lot of organizations also think about the cost structure associated with key activities and key resources that are needed to deliver the value proposition. And then they think about the revenue streams that could be generated so as to generate profit. An important aspect of this business model is that they think about how they can create, deliver, and capture the value. But a key aspect or key critical element that misses or that was missed at the beginning of BigMedilytics project was the rules and regulation that is key to the healthcare projects. As you might have also heard a lot of times in yesterday's presentation, that GDPR plays a key role, and it underlies various key activities that are involved in the BigMedilytics project. So that's why we had to think about a new healthcare canvas. That's what we call it now, and we added some new additional features to this healthcare canvas, and we also kind of remodeled it. We will shortly show you a newer version of it. Another key element that I would like to point out is that in the traditional business canvas model, the focus is on the profit. As I already explained earlier, that the focus was on cost and revenue. So most of the organizations think about delivering profits, whereas if you look within the healthcare domain, the the focus is not so much on profit, but it's rather about delivering value to the customer, and in this case mostly patients. And if you look at how value is defined within the healthcare domain, it mostly focuses on how we can better the health outcomes, depending on how much money we are spending. In our case, or within the BigMedilytics case, since we are focusing on European Union projects, it was about how much health outcomes can be improved based on per euro that is being spent. So the ultimate objective of the healthcare system is about whether the innovation within the healthcare domain is able to create a net positive value. So the focus is not so much on the profit, but it's all about creating a net positive value. And in relation to it, if we look at the cost part, then who is willing to cover the cost of the innovation? So that is so in healthcare domain, we move from a perspective that focuses on profit generation to a perspective that focuses on developing or delivering net positive value. As such, we created a healthcare canvas for the BigMedilytics project, which focused on delivering the value. And as you can see in the healthcare canvas, uh, at the bottom, the rules and regulations also play a key role, and they underline the complete functioning of various activities that take place within the big Medilytics pilots. And if you move a block up towards value delivery, we rename the cost structure, and we rename the two blocks at the end, at the bottom of the traditional business model, with cost structure and cost coverage, so as to highlight that the fact that we are focusing on generating a net positive value within the healthcare domain. In addition to that, another aspect that plays a role within the business model innovation is that traditionally business model has looked at a single snapshot in time. So it has focused at a single point in time to think about how we can generate profits, or how we can generate revenues, and how we can cover the cost. Whereas in a healthcare project, or for that matter in a innovation project, there are various stages that are involved in the development of a new idea. So as we also looked within the BigMedilytics project, there were three phases that were involved in various pilots, which relate to creation of the pilot, so which was about prototype development, then how each pilot scaled up that prototype, and then how to sustain the prototype beyond the BigMedilytics project. Within the scope of BigMedilytics project, we focused on the two phases, the first two phases, which was about creation. So the creation of the prototype within each pilot project, so the development of prototype, and how that pilot or the prototype could be scaled up so as to deliver the value. In that sense, we thought that business model, the traditional business model perspective, which looks at a single snapshot in time, is not sufficient enough to look into the complexities involved in moving across different phases. The reason being that the different elements of the healthcare canvas, or for that matter traditional business model canvas, could change or could vary between different phases. To give you an example, in the creation phase, there could be certain key partners that could be involved in development of the prototype, whereas in the scaling up phase, some of these key partners, such as payers or providers, could become customers, because they also derive value from the prototype or the innovation that is being developed. That's why within the BigMedilytics project, we use the notion of business modeling, which basically focuses on conceptualization of business model as a complex system, and how different elements of this complex system. By different elements, I mean value proposition, customer, key activities, key resources, key partners, cost structure, and cost coverage changes across different phases as the pilot moves from prototype development to scaling up beyond sustenance. We didn't focus so much on the sustenance part because that was also not so much within the scope of BigMedilytics project, and also as per the guidelines defined for the BigMedilytics project, the focus was more on the creation and scaling up part. But we didn't ignore the sustenance phase, but we also developed some kind of action plan. We'll touch upon that action plan towards the end, and how each pilot team developed an action plan to think beyond the BigMedilytics project, and think about how the pilot that was, or the prototype that was developed and scaled up, could be sustained beyond the BigMedilytics project. So these were the perspectives that we had to alter or refine for the BigMedilytics project, and these perspectives helped us to come up with the healthcare canvas. And using these perspective, we looked at the we use the we use the healthcare canvas within the BigMedilytics project to think about what elements are important across which phase. So now my colleague, Professor Erik van Raaij, will touch upon some of these elements and will provide you examples of how healthcare canvas was specifically used within the BigMedilytics project.
Yes, thank you very much, Vikrant. So our task within BigMedilytics project was to challenge all the 12 pilot teams to think about the business aspects of the innovation that they are developing. And we did that by asking them to fill out the different parts of the healthcare canvas at different points in time also. That also illustrates this idea of business modeling, which is a process of adapting your business model over time as you go from the pilot phase to scaling up. And of course, in the near future, we hope that most of the pilots will also sustain beyond just this innovative phase, but really becoming adopted in the healthcare domain. So we first had to develop this specific adaptation of the original traditional business model canvas, like Vikrant has explained. And you see here again the main elements of that healthcare canvas. So it has been adapted to the healthcare context, but it has also been adapted to the fact that we are talking about big data and artificial intelligence related innovations. So what I would like to do now is to take you through the different boxes, and we start with the customers. And what we will share with you is the types of responses we got from the different pilot teams. Now, of course, we cannot divulge any confidential information, so it's a bit of a high-level insight that we are providing you across the 12 pilots, what kind of business model elements these pilot teams have developed as they were challenged to fill out this healthcare canvas. So if we talk about customers, it's actually the interaction between customers and value proposition. So after this, I will quickly go into value proposition. But when we talk about customers, we asked all the pilot teams, can you identify the different groups of customers that could benefit from the innovation that you are creating? And what you actually see here is literally a part of a PowerPoint template that we used and that we gave to all the pilot teams for them to fill out. Then we would collect the input from the different pilot teams, and in workshops, first physically and later online, we have developed these different elements together with the pilot teams. So we can look at a couple of examples of what the pilot teams gave us. And here you see for the 12 pilot teams at the top of this table, you see that they did identify different customer groups, but it's very clear that the patient, the medical professional, and the hospital, the healthcare provider, they were seen mostly as the beneficiaries of the innovation that's being developed. Now, for none of them, it counts that all the pilots had that particular customer group identified as a beneficiary, but 11 out of 12 mentioned the patient, 11 out of 12 the medical professional, and 11 out of 12 the hospital. And of course, in the presentations that you saw yesterday, but also this morning, you could clearly see how the big data AI innovation could benefit two or maybe all three of those main customer groups. Also interesting to see that some pilot teams identified a very specific additional customer group that could benefit from their innovation. Now, since business modeling is a journey, we would also expect that this might change over time. So as the pilot teams, the prototypes have been shown to work, they're being implemented first at a single hospital, maybe at multiple hospitals. We could expect that also pilot teams would start ticking more boxes in a matrix like this. Okay, let's go back to the canvas as a whole. And as I said, the value proposition is very tightly linked to the customer groups. So it makes a lot of sense to look at that next. And so looking at the second bullet point here, we asked all the pilot teams, please identify the core values that the innovation would provide to these customer groups. And we also used a small tool to specifically tease out the value proposition. And we talked about what pain do certain customer groups feel, and the pain that you might take away with your innovation, or what are the gains that these customer groups might derive from your innovation. So we talked about pains and gains, and that helped each of the pilot teams to think about what really is the value proposition. Now, it would take too far to give you a total list of all the value propositions, but we looked across the 12 pilots, and we can share some examples with you. And again, you will recognize many from the different pilot team presentations that you've seen. So if we now focus on the three main groups of beneficiaries, the patient, the medical professional, and the hospital, you see that value propositions were, for instance, around less hospitalization of patients, higher quality of life, and more effective and personalized treatment. So when we talk about big data, the use of big data, the use of artificial intelligence, these are typical outcomes that these pilot teams expect that their innovation might provide. For the medical professional, improved decision-making. So that really is about better targeted decision-making. We've seen, for instance, the pilot teams with visualizations that could help medical professionals make better decisions, but also receiving more accurate and timely data about patients. And also for medical professionals, better allocation of time, which should also translate, of course, into higher satisfaction for the medical professional. And when we talk about hospitals, we saw examples of lower cost per patient, more efficient use of assets, and higher productivity. So these are all examples of these value propositions that we have seen across the 12 pilots. So going back to the overall canvas, we now move into the three areas that are about how to create that value. And the first one is key activities. So if we look at key activities, we are discussing with these pilot teams what has to be done in order to create the value that you are proposing to these customer groups. And we asked the pilot teams very explicitly what specific one-time activities are necessary to build or create the innovation, and what specific recurring activities are necessary to operate the innovation. And these are two different phases, and it's not always clear-cut because there will be activities that you do at the beginning and you might have to repeat them also later on. But making this distinction does help to think about, okay, there's certain things we need to do to create the innovation and make it work. And then there's another set of activities that we need to do within the hospital or the other context to keep operating that innovation. So again, across the 12 pilots, let's have a look at a couple of examples. And it's interesting that the list for build is longer, I think this also shows that that's really what BigMedilytics was also about, to make it work, to create these prototypes. But of course, BigMedilytics is also about a lasting impact on the EU health sector. And that, of course, means that recurrent activities are also very important. A lot of build activities around the technology, develop the infrastructure, the software, algorithms, but also activities related to the data itself, to clean the data, to make the data ready for use. Integrating the innovation with existing legacy systems and processes. That was, of course, very important. And integration doesn't always mean full integration, because for some pilots, it actually meant it had to communicate with existing systems, but sometimes it was really built as on a separate server that also has to do, of course, with data integrity, etc. So integration doesn't necessarily mean it becomes a full part of the hospital system, but at least for some pilots, it needs to communicate with existing systems. Data protection compliance was, of course, very important as an activity, and training users, sometimes medical professionals only, sometimes patients, sometimes both groups. So these were the build activities. And on the other side, recurrent activities, signing up new patients as they come into the clinic, adding new assets to the system. I'm particularly thinking about the 4 pilots in the industrialization theme of BigMedilytics. User support as a recurrent activity, and of course, systems maintenance. Of course, diving into each pilot separately, you would find many more activities, but this is looking across as the most frequently mentioned activities. So taking us back to the overall canvas, the next one to look at is the key resources. So what are the different types of resources that are needed, again, to build the innovation and to deliver the innovation on a day-to-day basis? The same distinction that we've seen previously. So let's have a look at a couple of examples. And first of all, a lot of pilot teams thought about physical resources, but later on, thinking more about everything that is needed, there's also a lot of human resources, both needed to build, but also to operate. And at the right-hand side, we have this remark that an interesting observation was that for pilot teams, they found it quite easy or straightforward to think about resources to build, but it took a little bit longer to think about what resources would be needed to operate. And we recognize that a lot of the energy was into building that innovation, building the prototype, making it work, and only at a later stage, the focus became more on resources to operate. And again, this illustrates the business model journey that Vikrant already talked about. Different phases leading to different ways of filling out the boxes in the healthcare canvas. So we see resources in terms of hardware, software, and human resources, medical expertise, technical expertise, legal and ethics expertise, and also project management expertise. And on the right-hand side, resources to operate, consumables, like for instance, the tags in the presentations we saw this morning, but again, also human resources, medical and technical were the ones most mentioned in the resources to operate. Okay, let's go back to the overall healthcare canvas, and let's have a look at the third of the 3 boxes on the left-hand side, and that is the key partners. Because many innovations, they're not being generated by just one actor in the healthcare system. All the pilot teams were sets, combinations, teams, multidisciplinary collaborations to create the innovation and also to operate it. Again, we asked the pilot teams to make this distinction. What key partners do you need to create the innovation, and what key partners do you need to run the innovation on a day-to-day basis? Now, it differed quite a bit, but still looking across the 12 pilot teams, if we look at the examples, we can see that there's also some commonality between the 12 pilot teams. All but one pilot team developed the innovation with the involvement of a hospital. So what we did observe is that looking at the different lists of partners that we saw, there was And of course, this makes a lot of sense, but there was this healthcare provider that was at the core of developing this innovation. It could be to ensure access to patient data, but of course, as we saw with the resources, medical expertise is needed, and that's why these providers were part of the teams. Also, medical software vendors or technology vendors were very often involved in all but two of the pilot teams. We also saw that these two partners were typically in the lead, either led by a hospital or a technology vendor. So what we did see, and it struck us, is that experts in legal or ethics matters were often not explicitly named as a partner. They were consulted, and more pilot teams, of course, started to realize that they needed to consult this expertise. But looking at the lists of partners, these actors were not typically listed as a partner in the pilot team. We saw that for scaling up, new partners need to be found, and especially you cannot leave it just to the one hospital or the one healthcare provider that you're building the prototype for. You're looking for new partners in order to scale up. And we also saw that it could be either looking for new partners as healthcare providers, where this innovation could be implemented, but also partners to make a commercial product based on the innovation. For some pilot teams, there was a commercial partner already from the start, but for other pilot teams, they explicitly said, for scaling up, we need a new partner in this area. So then if we go back to the overall canvas, I think it makes sense to first have a quick look at rules and regulations. And then we will also look at the final part. So we asked all the pilot teams, are there specific rules and regulations that you in your innovation, for your innovation, that you have to specifically look at? Now, it would be no surprise if we look at the examples that the GDPR is, of course, one of those key rules and regulations that pilot teams were looking at. But if we click on the examples, you will see that also some other types of rules and regulations were mentioned. And those could be regulations specific to the hospital. It could be regulations specifically related to telecommunications, but also industry standards like ISO were mentioned by pilot teams, and some of them mentioned specific industry codes. And there was a lot of awareness in all of the pilot teams that specifically working with big data and artificial intelligence, this was an important part of the business model. You have to manage this part in order to create value for the customer groups. So finally, the value delivery part, where we asked all the pilot teams to think about cost structure and cost coverage. Now, this is specifically a part where there's also a lot of confidential information shared with us, and we will not share it here, but we will again try to give you an overall picture of what the pilot teams, what they thought about, what they considered as they were filling out these business model healthcare canvases. So for the cost structure, the key investment costs in creating the innovation and the key operational cost for running the innovation. And on the cost coverage side, we asked them, what financial opportunities do you see to offset the cost of the innovation? So where are the gains in the system that could offset the cost that you need to make in order to build and run the innovation? And who would be willing to bear these costs? Who in that healthcare system is benefiting from the innovation and could therefore also be willing to bear some of the costs? And that could be in terms of really paying, but it could also be by putting in effort and time, so more of an in-kind contribution. So let's have a quick look at the examples. Again, like I said, not a lot of detail, but like I said, we had to think about investment cost versus operational cost. And what we saw is that when we asked about cost coverage, the BigMedilytics funding, of course, coupled with in-kind contribution, covered the investment part for all these pilots, but the challenge was mostly in thinking about where in the system can we find actors who might be willing to cover part of the cost. And just to give you a picture across the 12 pilot teams, some pilot teams could already be very specific both in the cost categories and the amounts. So knowing exactly what it costs to build the innovation and also to run it, and could also be very specific about how to cover the cost, identifying actors in the system who would be willing to pay for it. And for some other pilot teams, this was still a little bit further away in the future. So they are in that journey that Vikrant showed. They are not all at the same place at the same time. Okay, so hopefully this has given you an interesting overview of what we collected. And now I'm handing back to Vikrant to take you through some final thoughts about business modeling around big data and AI innovations.
Thank you, Professor Erik, for explaining the healthcare canvas. Now, once we use the healthcare canvas, and as I had mentioned earlier, our focus was more on the creation and the scaling up phases. But also, it's important that these pilots, the innovation that was developed within each pilot, was able to sustain beyond the BigMedilytics project. To that end, we created a future action plan tool, and in that we had specifically four objectives that we covered. So we posed to each pilot team that the four questions that they had to focus on, so as to think about how to sustain their innovation beyond the BigMedilytics part. And in this template, we first focus on the objective, that how each pilot can think about different activities or tasks that they need to carry out to sustain the big data innovation at current scale, post the current EU funding. So they had to think about various tasks and resources that were needed to complete these tasks. We cannot share the information again, as Professor Erik mentioned, that due to confidentiality reasons. But each pilot team then came up with the action plan and the tasks that were needed to sustain the big data innovation that was developed within each pilot, and what resources were needed, or if they have already acquired these resources, or what actions they had to take to acquire those resources. The second objective that each of the pilot team had to focus on was a notch higher in terms of scale, which was to think about how to scale up the big data innovation within the same disease and within the same country, so within the same healthcare system. So again, the various pilot teams thought about the tasks and resources to that end, and came up with the potential action plan to think about how their innovation can be used within the same disease or within the same country. So for example, that one of the things that some of the pilot teams did was they developed their pilot innovation within a specific geographical area within a country. So they thought about how they could scale it up to the entire country, considering the same healthcare system. And then they thought about the resources that were needed to sustain or to scale up this big data innovation within the country. The third objective then each pilot team had to think about was how they could replicate the big data innovation in other countries or healthcare systems. So they had to think about the other countries or the other healthcare systems, and some of the teams, they focused only on a particular disease, as some of the pilots focused on a particular disease. So they focused on replicating or the big data innovation in other countries within the same disease, and not within the entire healthcare system, but how they could replicate the solution related to a particular disease in another healthcare system. So they came up with the action plan and the tasks, what they did for objective 1 and 2. And last but not the least, they also thought about how they can replicate the big data innovation across other diseases or conditions. So some of the diseases could also be similar. So for example, the oncology kind of pilot could be replicated in other type of cancer, but they could also think about other potential application areas where it could be replicated, or other types of conditions which could be very similar to cancer type of treatments or require same type of innovation. So these were the four objectives with which each pilot team worked and came up with a future action plan. And finally, we had a overview of different teams, different objectives and action plan and tasks that each team had to perform. Some of the team were quite advanced in executing some of the objectives, while some of the teams are still in is a state in progress, or work in progress, I would say, to implement some of the action plan objectives. So what we saw or what we observed was that some of the pilot by default could be covering all the four objectives, whereas for some other pilots we saw that they had to start building up from objective 1 and then moving towards 2, 3, 4. So this was the work that we did within the BigMedilytics project. In the end, I would also like to point out to you that this work was done by three of us. So by and the third member of our team, Anka from AXA, couldn't be here due to her prior work engagements. But Anka was involved from AXA, which was a business partner, and who also looked into ensuring that if she could help some of the pilot teams to build up some partnerships during the scaling up phase or during the sustenance phase. And as such, her role was to mostly focus on how some of the big data pilots could be sustained beyond the BigMedilytics funding, and how they could focus on some of the financial aspects which are also much needed for sustaining the big data innovations that were developed within the BigMedilytics project. We thank you very much for your attention. This was the presentation from our side on BigMedilytics project. I also noticed within the chat function, so when I went, I just realized I'm going to unshare my screen. So I'm going to start sharing my camera. Eric, perhaps we could cover some of the questions that were asked in the chat function. So in the common chat function, Bert specifically had a question related to the cost structure. So you mentioned, Professor Erik van Raaij, you mentioned initial and recurring activities in cost structure. Should we not consider more recurring costs? For example, data curation and keeping systems compliant is not a one time but a recurring activity generating significant costs over time. Also thinking of promotion or communication or training costs over time.
Yeah, and I think that is indeed a fair point. I also see that our colleague, Professor Antoinette de Bond, has already started answering the question. And I think the main part to it is that what we indeed try to do is, by asking challenging questions to these pilot teams, is to make them think about all these different elements. And it was nowhere that at some point we would say, okay, now you've answered everything correctly and now you're done with developing your business model. Very explicitly, it's business modeling. It's a continuous process. You would have to reflect time and again on, is this really the key activities, the key resources, the key partners? Should we reconsider now that we are either growing or new insights come in? So yeah, I think we have achieved a lot by challenging pilot teams to think about these different elements. And I also think it's about time that they start looking at the business model once again and thinking about, okay, what would our next update of the business model look like?
Indeed, another question from Bert was about that almost no value identify for software vendors and HC service provider. Then why should these stakeholders have interest and invest?
Mhm.
I think it's a very valid point, and I think Bert, what you are mentioning, I would also like to point out to you that what we presented in our presentation today is just glimpses of what we did. It's not an exhaustive list. So there were consideration that were also paid. So there was also value proposition that came into picture. But what Eric shared during his presentation was the top three customer groups, but that is not to say that the other customer groups are less relevant, but it's what the different pilot teams identified and what we saw recurring as a theme. You have to also understood that four of the pilot also focused on industrialization of healthcare services, where the software vendors themselves also derive a lot of value. So we just presented some of the examples and we wanted to showcase some of the learnings, but it's not to say that it's a exhaustive list. If you would like to know more about it, we would be free to discuss this over a cup of coffee and also share our learnings related specifically related to the software vendors and service providers. Now, let me again see if there are further questions. If you have any questions, please you can ask in the common chat lounge. We would be more than willing to answer some of the questions. I also would like to thank Professor Antoinette for answering some of the questions on our behalf, and she also covered some relevant points.
Yeah. Well, I think as such, we can keep monitoring the chat. We don't have to remain in the. There's a new one coming in, but I don't know whether it's for us.
So I think Professor Antoinette, I don't know whether that question is for us or for the chat, the audience as a whole. Like, what was the most surprising element, maybe within the presentation, in terms of most key striking insight that was generated through the business modeling exercise within the BigMedilytics project? Perhaps Eric, you would like to share the most key important striking
Yeah,
learning for you?
maybe one observation is that in most of the teams, most people were either data scientists or medical professionals, and a few of the pilot teams also very explicitly had some business people in it. So challenging these teams on really business-related aspects like business modeling, yeah, that was, yeah, in that sense, very nice to do because it was also new to the teams. So we were really bringing in a new perspective. And it's surprising in the sense that, of course, with our background, you come in expecting that the business model concept is known to everyone. And of course, you quickly see that this is yet another perspective with its own language, something we discussed yesterday, with a new language being used to think even more about what are we developing and how is it going to help the European healthcare sector. So I thought that was a very pleasant surprise.
Thank you, Eric, for sharing your insight. For me, what was really interesting to note was that when we presented this healthcare canvas and we started talking about the positive value, the net positive value, some of the pilot teams identified with that concept that, okay, yes, in healthcare, our focus is not so much on generating only profits, and they were also really happy that with this healthcare canvas they could focus on that perspective of generating net positive value, as compared to that's what we also noticed in some of the workshops, that some of the doctors always thought maybe they were already accustomed to the traditional business model canvas, because they thought, oh, we always thought the business model canvas focus was only on generating profit. Uh, and that might not align with what is needed in healthcare, because our focus is mostly about generating a net positive value. So that was really a nice, I would say, input that we heard from various pilot teams, that they also identified with this perspective, and they also realized the value of the adapted or the modified healthcare canvas that we used for this project. Let me quickly check if there are any further questions. I don't see any. So I think Antoinette asked a question: what was for you a original business model that the pilots suggested to you?
Yeah, I would say they were all original. So there's not really, for me at least, not one that pops out as, if you really want to learn how to look in an original way, you must look at this specific pilot. So for me, it was a pleasure to work with all of them. Although in the workshops, of course, we had to split up. So there's a couple of pilot teams that I saw a lot more frequently than the others. So yeah, there's not one that is the most original to me.
Yeah, I also I would say I don't maybe yeah I don't see a original business model, in the sense maybe we adapted the traditional business model in healthcare canvas, and also I think I would say we didn't see a original business model in the sense, because I mean in the sense of original business model, because we use this notion of business modeling, and that's why we asked each team to focus initially only on the activities, resources, and partners associated with the developing part of the pilot team. So I think that's what we focused on, and later on we focused on the scaling up part. So so that would be my answer. I think there is also
Yeah, but it's more of a comment from Bert Verdonk than a question.
yes. So I think Bert has. So Bert says he's clear on the net value, and profit should not be the only value driver. So many of us strive for the quadruple aim, each aim being very relevant in itself, with or without a direct profit impact. And on the later question, SaaS models do not require a lot of upfront investment. That is probably the way to go. So I think, yeah, I do not have a comment on the SaaS model itself, because that's something which was very specific to each pilot team. We just provided them the guidelines and provided them the room to be creative and come up with answers to different questions that we posed. We didn't specifically guide them in a certain direction, because we thought that's their expertise, which model they want to use, which machine learning algorithm they want to use, and for which purpose. But the most important thing was that they identify everything associated with a particular machine learning algorithm that they set up, so such as training costs, the initial training cost, and the operational training costs within the cost structure part, and what was needed to sustain it beyond the BigMedilytics part, by focusing on future action plan.
Yeah, it does remind me of one thing, Vikrant, the comment by Bert. We are really looking at the business model across multiple actors around the innovation. And in business modeling or in the business model literature, you sometimes see business, or you quite often see business models for one specific actor. And of course, in almost all of the pilot teams, there's also one actor who is a private for-profit company, is in the market to sell something. So that specific actor will, in the end, for him or herself, create a business model where profit will be important. But we have been focusing on this collaboration of multiple actors focused on creating value for patients. And on that level, we want to take out, we had taken out this profit objective and replaced it with the net positive value. So business modeling can be done at different levels, and we clearly did it on the level of this local system developing an innovation.
Yeah, so I think that's a very important point, that we also realize that we have to focus on, we have to take this macro perspective, focusing on each pilot, each innovation that was developed within each pilot. And later on, based on this business model, each key partner can derive their own business models associated with the overall business model. That was the notion we had. Otherwise, the complexity would be so much that if we had to consider even the business model for each partner, then we would be thinking about too many variables, and I think it would have been difficult to handle such a complexity within the BigMedilytics project, at least from our perspective.
Yeah, I completely agree.
I think there are no more questions, but please feel free to ask questions in the chat function. Also, you have, I think, our details available, so you can also ask questions in general to us. If you would like to know more about some of our key issues or want to discuss it, or if you have different perspective, then we would also like to hear about it. So we are we very much welcome a critique on our work, or if we could have done some things differently, because that could also help us to refine our understanding for future projects.
Yeah. So thank you very much. Thank you for being part of this session. Thank you for the interaction. And indeed, we will keep monitoring the chat lounge. If there's any question about business modeling, we will make sure to pick it up.